Hi, I'm Kathleen Moore. I'm an assistant professor of gynecologic oncology at the University of Oklahoma Stephenson Cancer Center here with Sarah Cannon Research Institute. From a pre-diagnosis standpoint, there are a lot of women in the United States who don't have a gynecologist. And that's okay if they have a physician who's paying attention to their gynecologic needs. So there's many internal medicine specialists who are excellent at women's health, and they do a fantastic, equal, and sometimes probably better job. And so I wouldn't make the statement that everyone needs to have a gynecologist, but every woman needs a physician who is paying attention to her gynecologic health, even if she's had a hysterectomy in the past. You'll be amazed at how many women have had a hysterectomy in their past and think because it was a complete hysterectomy that meant their ovaries were taken out, and they still have ovaries. And so I get referrals all the time for pelvic mass and someone with no ovaries, and yep, there's 2 ovaries there. They've been there all along. So I think one of the important things for every woman is to really know your medical history. If you had something taken out of you, you should know what that was, and you should know what parts you have left, which sounds very simplistic, but it's amazing how many women just were, especially some of my older patients, were just not told what happened to them at the time of their C-section when their uterus went away. They just assume they have no parts left. They've got a lot of parts left. Sometimes they have a cervix left, and they never have had a pap smear, and now we have a cervix cancer in a cervical stump because they didn't think they had any gynecologic organs. So it's very important that women know their own history and are really their own advocates. You know, I've not had any surgery, so I have all my parts. I had a surgery. I don't know what he took. I'm going to get the records, and my doctor's going to tell me what I have left in me to make sure that I'm getting all the screening tests that I need. So that's very important. Again, sounds simplistic, but I think a lot of women just aren't told. And then some of the onus is on the patient and some of the onus is on the physician to really be your own advocate for your screening tests. So women need pap smears. Women, in my opinion, every year need a pap smear. For some women past the age of 35 who've never had an abnormal pap smear, you can get them every 3 years as long as you have a negative human papillomavirus. That's statistically true. It gets very complicated, and you can imagine 3 years becomes 5 years, becomes 6 years. People forget. Doctors retire. Patients move. And so the screening falls off. So that is a recommendation. For cervix cancer, if you've ever had anything that's slightly abnormal, I screen patients. Lots of women who are older, 50s, 60s, 70s, think they don't need pap smears anymore because they're older, and cervix cancer is a disease of young women. But we know women are living longer. If a spouse unfortunately passes away, women are dating and remarrying or not remarrying, but having new sexual partners and getting re-exposed to human papillomavirus. Those women all need pap smears. So if you're 70 years old and have a new sexual partner, I need to be screening you because you're very high risk for having human papillomavirus and something developing. So there's no sort of age cutoff for a lot of our screening tests, and that's important for women to know as well. And then the other thing is what you referred to earlier, that if you know something's wrong, you have to be dogged about not being blown off as you have a little gas, or I get a lot of women with bleeding after menopause or some kind of itching in their vagina or their vulva, and they are given a cream, and no one does an exam. They're presumed to have a yeast infection. They get some cream, and then if that didn't work, they get another cream, and then 6 months later we finally find that they have a vulvar cancer, or they've been bleeding all along from their uterine cancer. So if you have a gynecologic complaint, you need a gynecologic exam. And if someone's not doing that for you, or you're not comfortable with who you see, then there are many places that you can go that will help you find a physician who will do that for you. But you have to a little bit take control of your own body and get things assessed that are concerning to you. In terms of the symptoms of ovarian cancer, again, it just goes back to something's not right. The symptoms of ovary cancer that we point to are not a screening test. So again, women that have bloating and feel full early, pelvic pain, most likely don't have ovary cancer. But a minute portion of them will. And that group is the group for whom those symptoms are new. So if your whole life you've had cramping and bloating and abdominal pain, you don't have ovary cancer. If you've been fine your whole life, in the last month you've been feeling bloated and your pants are tighter and can't eat and you're burping all the time, you need an exam, and you need a pelvic exam. And if someone's not willing to do that for you, you need to kind of up your search for a physician who will. Again, the chances are you don't have ovary cancer, but you're the person who we want to make sure gets in and gets a full evaluation. Several of my ovary patients every year are diagnosed when someone goes in to take out their gallbladder for those symptoms. Like, no one's ever done a pelvic exam. I don't know if anyone's examined them at all. They have symptoms. Someone puts a laparoscope in because they assume it's all their gallbladder, and they find their ovary cancer. So we see a lot of that. Just delays their definitive surgery.